It's a lifeline.
It's a life. Yeah, I mean, it's the drug is phenomenal. It's life changing.
We had no idea that we carried the CF gene.
Yeah.
So it was a massive surprise when we got the heel prick screening test results back.
Yeah. Well, I mean, the CF mutation, the genetic mutation, it's recessive in a lot of people, so you can carry the mutation and have no idea. And me and Jess both carry the mutation and had absolutely no idea. And then in order to have a child with CF, both parents have to carry the mutation, and then there's only a 25% chance that you'll pass both those on to your child. So the actual chance of having a child with CF are relatively small.
1 in 4.
No, but in overall, so it's like 1 in 2,500 babies born will have CF. So it's not super common, but there are a lot of people affected by it. Something like 11,000 people in the UK, and then. So to find out that Ottilie had CF was just a huge shock.
It was a whole new language we had to learn.
Yeah.
Medications, physiotherapy, hospital appointments.
Yeah, it's a whole routine. Keeping Ottilie healthy is a routine, and it involves a lot of time and effort, and
it is a very debilitating
condition. Yeah.
She requires lots of different medications, physiotherapy for her lungs. She's also pancreatic insufficient, which means that she has mucus sort of leading to the passageways of her pancreas. So she requires daily pancreatic enzymes which help absorb the fat in her food. And that requires so much planning because every meal that she has, we have to weigh out the fat content, and if we get it wrong, then there's repercussions with her bowels, and it's so hard to manage and balance.
I mean, the physiotherapy is also, it's a big part. It's all about
keeping a 2-year-old.
Yeah, it's all about keeping their airways clear and clearing out that mucus. And we've got a trampoline in the room because she's always having to do physical activity to try and keep that mucus shifted.
Antibiotic nebulizers twice a day.
Yeah. And it's a progressive disease. So, it's the older they get, the harder that becomes, and the more the CF takes over.
The damage.
And that's why we do it, to try and prevent the damage done as much as possible. In the UK, the biggest charity for supporting people with cystic fibrosis is the CF Trust. And they did an Instagram post on Friday afternoon stating that the outcome of NICE's report, and I think it was just a huge shock to the whole community, and a very difficult time because obviously they don't. The CF Trust don't control when the information from NICE is announced. So we were kind of left for a few days with really not a lot of information. But still, over the last couple of weeks, the information it's not clear.
There is a lack of information.
Yeah,
I think there is.
There is quite a lack of information. A lot of families feel a bit
lost about what's going to happen.
I mean, it's certainly the NHS and NICE keep reiterating that anybody that is already on Kaftrio will maintain access, but and that's great. But there's something like 300 people every year. Well, I think I'm not sure if that stat's right. But there's a lot of people born every year with CF, and if the funding's withdrawn, every single year there's going to be more and more people that don't have access to it, and eventually there will be thousands and thousands of people that don't have access. So it's great that the people who are on it will have access, but what about everybody else that is going to be born, that is not yet born with CF? I mean, what are they going to do? So it's really, really important that something is sorted out. It is a lot of money, but
it's a lifeline.
It's a life. Yeah, I mean, it's the drug is phenomenal. It's life changing. We're not talking about a couple of years of extra life with, the life they have been better. We're talking about doubling their life expectancy. We're talking about, instead of them being in hospital multiple times a year, having week, 2 week stays in hospital at a time. Some of these people that are now on Kaftrio are not going to hospital hardly at all, apart from for checkups. Their quality of life is hugely improved.